First, it's my real, pleasure to be here, and I was going to thank Professor Bala, but I was told that he wants to be called Uncle Bala. I've known him for a very long time, and he's a true icon and visionary, and I think you're all very fortunate to have an uncle like this. I didn't have one when I was growing up. And also it's interesting that Dr. Mrs. Nirmala Menon talked a lot about men, women, feminine, masculine. I thought I was the endocrinologist, and all we did was everything about hormones and men and women. And I just want to start by saying very, very, very different. We are hardwired differently. We are biologically different, and let's celebrate the differences. So that's what I'm saying. But today I'm here for a completely different reason. I'm a physician, and my interest is women's health. We've heard a lot today about women in the boardroom and CEOs and how to get in there. But what I want to appeal to all of you young people is to become aware individuals, to become aware of what goes on around us, to become aware of our health and the people around us, their health, because ultimately, health is wealth. You can make all the money in the world, but if there's no health, that doesn't mean anything, and you can't buy health, so you have to take care of it. And each one of you, I think, has a responsibility when you go into the workforce to care for the people around you and your family and yourself. So I'll just show you some, interesting and sometimes disturbing data about what's going on in women's health in India. And we can use all the young, wonderful minds that we have here to take this forward. I told Professor Shanti that I'll title my talk as Minding the Gender Gap. And as you can see, this is this is Mind the Gap. You would have seen in all the train stations. So the gender gap does exist, and especially in healthcare. Enormous gap, and minding this gender gap is a responsibility of every citizen of this country. And I'll show you some stuff. This is Professor Shanta from Cancer Institute, and I have her picture here because when she won the Magsaysay Award, she should be very proud that she won the Magsaysay Award. They asked her, what ails the women of India? And she just said, there's something fundamentally wrong with them. They all still think they're martyrs in that Sati Savitri, mindset. And it's a kind of self-immolation, the way that they don't take care of themselves. So this is how she put it, and I'm not quoting her exactly, but this is what she said. And after being in practice in India for a long time, and I shared that with Gauri Kailasham also, that most people are clueless about their health. And there is this, and women, they will bring their family, they'll bring their colleagues, they'll bring their friends to consult me. When I ask them, what about yourself? They'll say, next time. I will make an appointment, I will come, but that day never comes. So women's health issues are different, and it's biologic, it's physiologic. Only women, babies, they can give, breastfeed them, they go through menopause, so there are a lot of physiologic issues, and hormonal, and then health literacy, plain literacy and health literacy are two very important aspects. Socioeconomic barriers are there, and psychosocial barriers, cultural barriers, which Nirmala Menon alluded to. And then, or is it all this and something else? We don't know. Something that makes the X chromosome different from the Y chromosome. We are wired differently, and let's just admit it. However, there's equality, and then there's also differences, which I think we should celebrate and not try to be anything else. So, for example, men like to read maps when they're driving cars, women don't. And that's just, I think, something genetic, and we are wired like that. So we should not even try to change it. So even Einstein agrees. He just can't figure women out, okay? But the landscape has changed, I just want to say. This is approval of women who want a job or a career outside the home. This is a Gallup poll that was done, and even this is already 2006. It's about 7 years old. You can see in the areas, in 1996, 54% of the women wanted a job outside their home, and in 2006, it's become 84%. So there is a huge difference. The landscape is changing, but what kind of work are they doing? A lot of sedentary jobs, a lot of stressful jobs, a lot of jobs that is keeping them away from home for long hours. I have a lot of patients and friends and family who are in the IT industry who work very long hours and travel like 3 hours to get to work every day. So they just spend most of their day outside their home, away from the sun, away from the families, sedentary lifestyles, which is impacting on their health in a very big way. Not only are these young women becoming sedentary, our oldies are also becoming sedentary. One of them is, of course, the computer, and the other one is, I'll show you later, is watching television. But we must appreciate the fact that women do have to juggle a lot of things. I'll give you a very quick story. A few years ago when I was in my clinic and a lot of patients were waiting outside, my daughter called and said, we had a dog who was going to have a baby, a puppy, so she said, Bambi's going to have puppies, come home. And I said, I have patient, can you call dad? But he's at work. So I'm just saying that dad's at work and what I'm doing is not work. But that's how, society, that's how the framework is. Mom is expected to do certain things, take care of the baby, take care of the house, get dinner ready, take the con call, make sure the husband is not disturbed, take care of the in-laws, which is all fine. I think we are designed for that and we like it, and I think we should cherish it. But in this juggling thing, I want to just give a piece of advice to all you young people. When you juggle, we all have several balls up in the air. Some balls are glass balls and some are rubber balls. The rubber ones will bounce back. Those are work, friends, colleagues. The glass balls are health, family, relationships. So you don't drop those. You can drop the rubber balls anytime and they'll bounce back and you'll be fine. In India, our biggest problem as far as the girls is literacy. So if you can all in some small way contribute towards literacy, improving the lot of the girl child, improving the lot of the young woman, I think we would have made a huge impact if we educate our children and make them stay in school till they are 17 or 18. So many problems will be overcome. Okay. Now, just want to show you what the labor force is looking like. And you just look at China and look at us. These are all probably some improvement. So sometimes when we talk about people in the boardroom, or sometimes when we talk about jobs and other things, we're really talking about one tiny percentage. The rest of India is out there. So we have to do our part also to help the rural Indian women. We have to do our part to help the other, not so fortunate people in India. And just to show you the seats held in parliament by women, and you look at India, we are somewhere in yellow, which is less than 10%. So we really still have a very long way to go. But where do we start and what are our problems? We have to start with the girl, because the clock starts ticking a long time ago. And why adolescents and why now? And I want to show you here. Adolescents form the very big part of our population. In India, something like 50% of the population is under 25. And out of that, 25% of the people are adolescents. So adolescent health is very, very important. And I want to bring something up here, and maybe I'll tell Dr. Sriram here. You have to remove the Coca-Cola and dispensing machine from Great Lakes. Okay? And the reason being, in our country, we are having this very difficult problem right now. On the one hand, we have malnutrition and we have children who are, not healthy. And then on the other hand, we have tremendous childhood obesity and issues. And before I go any further on that aspect, I I want to tell you this, adolescent health is very important because if young people get married, see this, mother's age is a risk factor for children's health problems. And be it dying, being underweight, or not growing, that's stunting, illnesses like anemia or diarrhea, there's a huge connection between mother's age and the baby's health. And unfortunately, there's a lot of babies that are low birth weight and not doing well in our country. And very sad, if you look at this, national prevalence of small for gestational age, meaning low birth weight babies, we are in this dark red. So India has a lot of problems with low birth weight as well. But then we also have this other problem, which is, I call India rising. We have this issue of, overweight issues. And this is a study done in Chennai, which shows if you compare men and women, whether it is children or adolescents or adults, women tend to be more overweight. And what's the reason for that? Many reasons. Some are hormonal and biological, but a lot of it has changing lifestyles. Women have gone from a traditional, what they were doing in the households, to what they are doing now. I appreciate that, but we have to be careful. So if you don't move, this is what happened to Mona Lisa. So if it can happen to her, it'll happen to you. And in 1990, the TV was big, the people were small, but in 2008, the TV is small and people are big. So then one of the biggest problems that they have said is hour of TV watching translates to 2% weight gain per year. 1 hour per day. And our women watch 4 to 6 hours a day. So it's a lot of TV watching. TV watching aside, I just want you to translate that to sedentary lifestyles. So if women work in a sedentary job in IT industry or back offices or call centers or wherever, this is what could happen to them. And this is what is happening to our population. Very, very young people are developing type 2 diabetes. We always thought that diabetes occurred in older people, and type 1 diabetes only happened in young people, but we are beginning to see my youngest patient with type 2 diabetes, which is the diabetes of the adults, is 8 years old. So, but they're also, even younger than that. So, just to show you. So, this whole education about lifestyle has to begin at a very, very young age. And again, I was sharing this. It's a very difficult task when you have Amitabh Bachchan selling Maggie like it's mother's milk. So what chance do I have, or what chance do people who are trying to change any policy have when there are these huge, powerful celebrities peddling things that are unhealthy? So we have a problem. And I want to bring up something very interesting here. All of us, some of us are overweight, some are not overweight. But we have a very typical Indian problem. You look at these two people. Unfortunately, I don't have two women to show you. The left side is Dr. Yudkin, who's a diabetologist. The right side is Dr. Yagnik from Pune, who's also a diabetologist. They both did their body mass index, which you all know is the way to find out if you're overweight. Your weight in kilograms divided by height in meters square. Indian people, they should be less than 23. They're both less than 23. But you look at the body fat content of Yudkin is 9.1%. Body fat content of Yagnik is 21%. That's because we are the thin fat phenotype. We're thin but fat. So, which is one of the reasons we are getting a lot of the non-communicable disease problems like diabetes and high blood pressure and heart disease and all that. So, we're thin fat people. Other things are happening. We have everything in plenty. When I moved to India, there was 1 Grand Sweets. Now we have 101. They just opened their 101st store. So everything is in plenty. And we always talk about KFC and burgers. And that's not the culprit. I think that's a culprit only in a small group of people. The culprit is actually this. We have everything else in plenty also. Lots of good food to go around and plenty of easy available fast foods. Another thing that's happening to the young women of India, this changing culture of drinking and smoking. I went to for a meeting 2 weeks ago. In the middle of the day, 12 o'clock, they're saying, would you like a cold beer? That's what they offered me to drink. So So mindset is changing, the culture is changing, women are smoking. So whatever you all can do, please discourage, because when women smoke, they have bigger problems than men when they smoke. Their lungs don't grow as well. They have other issues. And if they're planning a pregnancy, their ovaries pack up. You talk about biological clock, it packs up 3 to 4 years sooner than men if they smoke. So please advise your friends and colleagues and others if they smoke. Not only active smoking, but passive smoking. So if the guys smoke, they're hurting you. So please tell them not to smoke for your sake. Then we have multiple social issues, that everything revolves around marriage. I have 4-year-old patient who will have some hormonal problem. They'll ask me, how will her future be? And I'll say, her future is good. She'll be fine. How will her future be? And I'll say, she's fine. She'll study well. She'll get a good job. How will her future be? So they want me to say, will she get married and have babies? And she's 4 years old. So in the beginning, I was not aware of all this, so I was patiently explaining everything. Now I've gotten older and I've lost a little bit of the patience. So the moment they say her future, I say she's going to live her whole life. She's going to be healthy, she's going to be fine. She's going to study well, and that's all. I'm not answering any questions about marriage and children now. We'll talk about it 20 years from now. So but it all revolves around that. So women have issues, we have issues with marriage, with the contraception, because the less number of children women have, the healthier they are. Their children are healthier, they live longer. So contraception is very important. And pregnancy, of course, multiple health issues. But again, the landscape has changed. Women used to be old and 14 years old when they got pregnant, so they needed to be mollycoddled and nutrition taken care of and provided for, and now they are 30 and 35 and 38 and 28, and they're doing the same thing. They're eating for 3 people. Their parents and mother-in-law and mother are force feeding them and trying to fatten them up. And even Aishwarya Rai, unfortunately, apparently had issues with losing the weight after her pregnancy. So they can have a lot of difficulties with weight gain and losing that weight. So postpartum care is very important. Domestic violence. Our women suffer a lot of domestic violence, and because of that, a lot of health issues. They neglect their health, they ignore their symptoms and signs, and then they come back very late, which all kind of goes to domestic violence. A little bit of good news, life expectancy has increased. Menopause was happening at 50 years from the days of Manu Shastra to now, still 50 years. But except women are living well into their 80s and 90s. When Yasser Arafat died at 75, my father was saying, "Pavam chinna vayas." So he was 75. So 85, 90, 95 is the average now. So 75 has become young. And women live well into their 90s. My grandmother died at 97 last year. So because of that, and they're living longer, many of the chronic problems, health problems like osteoporosis and dementia and Alzheimer's and diabetes and high blood pressure, heart disease, all those things start affecting the elderly. So we also have a major responsibility to take care of our elderly. They have a lot of non-communicable diseases, several problems of aging, which I just talked about, economic dependence, depression and loneliness. All the kids are in America or someplace all alone. These 2 people will be staying in India and coming to, it's very sad to see 80-year-olds and 90-year-olds coming with just each other for a consultation with no one else, or sometimes a driver. And that's where we are going, and someone should do something about it. And like I said, dementia. Very quickly, you're all people in management, to give you a little taste of what our country is doing for healthcare. So non-communicable diseases have gone up, communicable diseases have gone down, which is good. But if you look at healthcare expenditure, percentage of GDP, we are somewhere way down at the bottom. But if you look at out-of-pocket health expenditure, we are right at the top. So in our country, we do a lot of out-of-pocket expenditure, and that's a particularly big problem for women because many of them are economically dependent on husband or son or someone. So it's a very big issue. And if you look at the Indian healthcare sector, this is from just KPMG a couple of years ago, you'll see that hospital costs are enormous, 50%. I recently had a hospital administrator who came and told me, why don't you admit more patients? And kept harassing me for 10 minutes on, he said, you see a lot of patients, but you're not admitting anyone. You're seeing a lot of patients, you're not admitting anyone. So I kept giving him all the right explanations, but finally I had to tell him, look here, I went to medical school to keep people out of the hospital. You're asking me to put them in there? So fundamentally, our agendas are not matching. So if you really want to continue this conversation, we'll meet in the boardroom. We'll meet with the board of directors, and I will come and present my case. After that, I didn't hear from him. So the message is, you have to have power of conviction. You have to be ethical. You have to be principled. You have to stay your ground. Then no one, no guy, no man, no woman, nobody can shake you from where you are, from your position. And so that is the message I really want to give you, beautiful women here and the men, that you have to be principled and ethical in whatever you do. Then no one can, touch you. Yeah, and I showed you the GDP, and I showed you the healthcare spending in terms of, but if you look at private spending, it's higher. But even in the public sector, out-of-pocket spending is like 25%, because a lot of people don't want to go to government hospital, wait for 10 hours, not get the right care. They don't see the same doctor. They get treated like, some exhibit A or exhibit B. So they don't like all those things. So they spend out of their pocket. Couple of comments about our rural women, very, very important. Absolutely, you look here, doctors to population ratio in rural India and in urban India. So each and every one of us must do something. Don't depend on our government. They're not going to do anything. They themselves say that. We have the money, but we don't have the bandwidth. We don't know how to do this, so they're not going to do anything. It all has to be either public-private partnership or all private. And, people like Dr. Bala are the ones who can actually make a difference in this country, even at this level. So I'm going to conclude by saying recently I've taken a big interest in working on diabetes in women. And the reason why we chose to take one area, diabetes, is because it's enormously staggering numbers, rising morbidity, higher costs. And just to show you, the world has 371 million people with diabetes. India has 70 million of them. And this is diagnosed. We have an equal number that's undiagnosed. Okay, this is now, right? I want to show you a projection that the International Diabetes Federation projected for 2030 as 366 million. We are already we are already close to that, and it's only 2013. So all these projections are only for the birds. We are going far ahead of those things, and a very big problem. And 4 out of 5 people with diabetes live in low and middle income countries. And diabetes is the one that is truly, look at the health. 465 billion worldwide. 11% of the total healthcare expenditure in adults is on diabetes. Just to show you some data from India, very, very recent. Look at Tamil Nadu, amount of diabetes. And even a place like Jharkhand, very high. And if you look at, I'll show you something on women. Why women? Because they have more diabetes, higher mortality, more heart disease, not heat disease, more heart disease. They're more neglected. And we just did a small pilot in Tamil Nadu, and we found out of 2,500 women, 1,500 were 2,500 men and women, 1,500 were women. And women are not supposed to be having health-seeking behavior. So when we did the survey, if we found the reflective of what is going on, out there. And in all the districts, you can see that there was more women. And if you see here, the saddest part though is, even in rural India, there is more diabetes in women than men. Very, very sad. So very disproportionately affecting the women. And pre-diabetes, which is also seems to be more in women compared to men. But we are also having these issues, explosion, and this side we have limited trained personnel and we have limited resources. So this is a very big problem, and global studies have shown that women seem to be at greater risk for heart disease, high blood pressure, diabetes, and cost-wise. There is a lot of expenditure incurred by urban and rural people. I think more rural people. So the last part, as Randy Glasbergen says, in an increasingly complex world, we need to find new answers to old problems. So we are launching a campaign. The campaign is targeted at 6 targets. One is high school and college girls, young working professionals, pregnant women, women with diabetes, caregivers, and also people who are homemakers. So through multiple portals, we want to somehow reach out to all these people, whether it's a website, whether it's a newsletter, whether it's a direct one-on-one, whether it is other media, print media. So we feel the time is to act is now, and we are taking on this thing. A lot of us are doing things, but this is what is happening, and our aim is to somehow get the whole country. So next week, and that's how it all started. I called Dr. Bala to invite him to come to this program, and I ended up getting invited to come here. Thank you very much.